Hello, this is Jeff Closeup and I'm Carol Celine. My guest today is Dr. Tony Koo. Dr. Koo, I understand that you came here from Taiwan when you were about 15 years old. Was that a difficult adjustment?
It was definitely an adjustment, but it wasn't too bad. I think because the teachers and students were really helpful and supportive. They've made me feel welcome and feel like I was part of the community from day one.
Was your family influential in steering you into medicine?
Not really. My parents were always tough on me, academically speaking. They wanted me to do my best. And I remember my dad telling me as a kid that I should at least go to college, and if I could, I should get an advanced degree. But the decision going to medicine was my own.
And I think you told me, though, that your mother was a career woman, and she's the one that was pushing you a lot.
Yes, she pushed me really hard, and she really believed that I should, do my very best in everything I do, and I should never take any time off from studying. So I felt really burned out after college. So I decided to, have some time to myself. I worked 3 jobs actually to keep myself busy. I worked as a research assistant. I waited on tables. I also managed restaurants.
Your family's in the restaurant business.
They were. So I was again happy that I was able to help out.
You now have 2 children, you told me. Are you going to be as hard on them as your parents were on you?
Probably not. I think we're going to be more lenient towards them. We want them to have a happy childhood.
What would you say are the 2 most important things in your life?
I would say God and my family.
So you're religious?
Yes.
You spend the majority of your time at the Navy Yard, practicing down there. What exactly do you do?
Basically, I see patients with chronic pain conditions. I see them in the office setting, and I schedule them for procedures if appropriate.
Well, that's interesting because I know from what you told me that you actually studied anesthesiology. Okay. So how is practicing pain management different from being an anesthesiologist?
Well, as an anesthesiologist, you typically will see the patient once, and you get the patient through the surgery, or even see the patient a few days after the procedure, but that's it. But as a pain medicine physician, I get to see the patient on a regular basis. You build a relationship with the patient. So for example, for cancer patients, they may not be a cure for their disease, but if I can improve their pain, I can improve their quality of life, and it will help them to cope with the situation, and that's very rewarding to me.
Well, but I would imagine that the goals when you're in an operating room are different from the goals of a patient who come into your office.
Yes, so in the operating room, basically, we want to make sure the patients are safe and comfortable throughout the procedure. So for the most part, if they're under general anesthesia, they're not aware of what's happening. But for chronic pain patients, basically, we want to provide good pain relief so they can have good quality of life.
And are any of the procedures similar, though?
Yes. For example, epidural injections or a lot of nerve blocks, they're basically the same procedures, just different medications.
So the nerve block, where sometimes if you're going to operate and you're sort of freezing someone from the waist down, that's what you mean by a nerve block, but they're much more targeted for pain management?
Yes, that's correct.
I understand. What would be the most common complaints that come into your office, and what do you do for those people?
In our practice, I think the most common patients I see would be someone with a chronic back pain. And most of them have lower back pain. A few of them had neck pain as well.
And what are some of the procedures available to help people with chronic pain who don't want to be operated on? And I guess there are a lot of those.
Yes, and in those situations, besides medical management, we will offer patients epidural injections or different type of nerve blocks or radio frequency ablation procedures.
What is radio ablation?
Radio frequency ablation is a procedure that, in a sense, utilizes microwave energy to destroy the nerves. Although we cannot fix the problem, but by destroying the nerves, the patient gets pain relief.
And do these procedures themselves cause pain?
Yes, they do, but usually it's for a day or 2 only.
So you might feel worse for a day or 2, and then you'll start to feel better.
That's usually how it is.
How do you decide what kind of patient a procedure will work for?
It really depends on the pathology. So, for example, if patient all of a sudden have a lower back pain with pain going down the leg, and you get an MRI study and you see because of disc herniation, patients like that usually would benefit from an epidural injection, in addition to medication, rest, and physical therapy.
And what would be another kind of patient?
For example, if a patient has lower back pain, it's due to the facet joints, which are the joints of the spine, and they may benefit from a facet joint injection.
So there are lots of places that you can inject.
Yes.
But essentially, you're using injections to kill pain. How about some of these other things I read about, like a TENS unit and some of the other kinds of painkillers? Do you use them as well?
Yes, I prescribe TENS unit very frequently.
Explain what that is.
It's basically a little device that is applied to the skin with electrical current through it. It basically makes the area numb.
And does someone wear this 24 hours? Or?
Usually it's maybe 3 to 4 times a day. It works very well for muscle spasm. And the latest study have shown that the machine actually target the same receptors as opioid pain medications.
Oh, so this would be an alternative to having to take really heavy-duty meds?
For certain patients, yes.
Huh. So for someone who has chronic pain, it's really worth coming in to see a doctor like you because there are things that can be done.
I would say so.
Thank you very much. It's been a pleasure to talk to you, Dr. Koo.
You're welcome. Thank you.